And today I told you about some main principles of physiology and blood system. You know, main role for cardiovascular system and for blood together. It's maintaining oxygen supply and nutrition supply for organs and tissues. And additionally, it's take part in excretion in removing carbon dioxide and some wastes from our body. I told you about this excretory activity in previous lecture. And additionally, you should know some uh, blood functions. It's not only transportation of gases, not only excretion, but additionally it's take part in transport of some hormones and biological active substances. On exams, students usually forgot about next function, so please be careful. It's take part in homeostasis, in regulation of pH in our body, regulation of temperature in our body, regulation of our ability to defend from some viruses and bacterial invasions. In common, we talk about immune function. And deponing function, it's storehouse of many materials. It's ions, electrolytes, amino acids, glucose, lipids, and so on. And many cells in our body, in our tissues, can take these nutritions from the blood for their own activity. And last function, but very important function, it's hemostasis. It's ability for prevent bleeding, and many components, many factors in our blood take part in this specific function. Main components of blood, you know, it's plasma and formed elements, and usually total amount of formed elements slightly less comparing amount of plasma. Formed elements divide on three groups. It's white blood cells, red blood cells, and platelets. And plasma, it's water and dissolved components like inorganic ions, uh, wastes, gases, and organic components. Mainly, it's proteins which divide on several subgroups. It's albumins, globulins, fibrinogen, and prothrombin. Proportion between formed elements and plasma, it's quite important for normal activity, normal realizing all functions of blood, and percentage of formed elements in our blood named hematocrit, and usually in average it's about 45%, but you may find in this slide this normal values depend from age and depend from gender. In newborn babies, hematocrit may vary and may be even up to 60-64%. In men's, hematocrit slightly more comparing to women's, and it means the total amount of red blood cells in men's more than total amount of red blood cells in women. So that's why hematocrit is slightly higher and depend from gender. And we used many chemical and biochemical parameters for measuring components of blood and ability for realized functions, which I told you before. For example, very well known in nowadays such parameter like amount of glucose in the blood. And it's quite important for early diagnostic such diseases like diabetes mellitus. But that total amount of glucose may vary, and in healthy persons, after eating, it may increase twice comparing to level before intaking food. But for diabetes mellitus, results even much higher. It may be about 120, 130 milligrams in 1 deciliter. And after food intake, it increased more than 200 milligrams. But in range before normal values and diabetes, we have a border which named impaired tolerance for glucose. And in nowadays, it named like pre-diabetes, and persons may have normal values of glucose in blood before eating, but increasing, for example, level of glucose after food intake, and it will be already impaired tolerance for glucose. That's why in many cases we use uh, parameter, total amount of glucose in blood, but not only at rest, but after food intake for more accurate result. Next parameter, again, it's highly important and well known in nowadays. It's amount of cholesterol in blood. And in novel guidelines, we tell about importance of several components. We have total level of lipids, usually in laboratory they name total cholesterol level, but they divide on subgroups with low and high density, such named bad and good cholesterol. And it's again highly important for clinic for early diagnostic such problems, such diseases like atherosclerosis, because increased amount of bad cholesterol, low density, may lead to damaged our blood vessels and lead to producing clots in our blood vessels. That's why these problems are again highly important, and we should early diagnostic these problems with measuring this parameter, amount of cholesterol and subgroups, good and bad cholesterol in our blood. Triglycerides, it's again one component of lipids. Usually, amount of triglycerides depend from food intake, because these components enter in our blood in intestine after eating, and high level of triglyceride, it's a result of good absorbing lipids in intestine, but decreasing level of triglyceride usually associated with malabsorption, with some problems in intestine. Next parameters, again, they may be highly important for clinic, for practical doctors. It's pH level, because normally our blood have quite stable pH. For realizing all functions, blood should have a stable parameter, and abnormal increasing of pH, it named alkalosis, or decreasing pH, it named acidosis. It's first symptom of many diseases. And normally we have ability in our blood for prevent from acidosis and alkalosis, such named buffer systems in blood for stabilizing pH level. For example, carbonic buffer system you may find in this slide. It's association of several reaction of producing carbonic acid from carbon dioxide and water, and carbonic acid may dissociate in our blood onto ions, and these ions may used for decreasing pH for put in our blood more hydrogen ions. That's why if we increasing speed of dissociation for carbonic acid, our body may decrease pH level, and vice versa. If we decreasing dissociation of carbonic acid, we may increasing pH level. And these reactions are highly important for normalizing pH and stabilizing in normal values. These normal values in range between 7.35 and 7.4, and you may find as increasing as decreasing pH abnormal may lead to disorders, and very serious increasing or decreasing may lead to death. But in this slide, you may find that death in alkalosis may become earlier. We have not so significant increase in pH, and this may lead to death. For acidosis, it's not so severe. We may change in wide range, but unfortunately, in very serious decrease in pH, again, it may lead to death. But why acidosis lead to disorders early comparing to, alkalosis lead to disorders early comparing to acidosis? It's due to our specific properties in tissues. You know, many biochemical reactions in our cells realized with help of producing acids. Many organic acids like lactic acid, pyruvate acid, maltosic acid, and so on, produced in our cells every moment. And buffer systems, carbonate buffer system, phosphate buffer system, proteins buffer system, and hemoglobin buffer system. All these systems in our blood used mostly for protect from acidosis. They have more powerful ability to protect from acidosis compared to protection from alkalosis. That's why in practical medicine, if you find patient with alkalosis, you should help him as fast as possible, because his own protective systems are not so powerful and may stop protection, and it will lead to death. Next components of our blood, which used for check up normal activity, normal functions of blood. It's amount of components for plasma. Normally, plasma consists from water. Mostly, it's 90 to 91%. 6 to 8% it's proteins, and all other components, usually it's around 1% only, It's inorganic substances, electrolytes, and mostly it's sodium, potassium, calcium, and chlorine ions. Other components again take place in blood, in plasma. It's hormones, it's glucose, amino acids, it's some wastes which we discussed in previous lecture. But all these components take place in very small amount. That's why usually we're measuring for checkup main components of plasma. And such important main components of plasma, it's proteins. And total amount of proteins, 6 to 8%, or we may measure in normal weight, it's about 65 to 80 grams per liter. All proteins in plasma, they divide on subgroups. Most important subgroups, it's albumins, globulins, and fibrinogen. Most frequent component, it's albumins. You may find in this picture. They including in our plasma, and from all proteins, they take part about 60%. And these albumins are used mostly for transportation for many nutritions, transportation for organic and inorganic components like electrolytes, ions, bilirubin, and very important for transportation of some drugs and for realizing osmotic pressure. What's this osmotic pressure? It's ability for proteins and especially albumins protect water from moving out from plasma into tissues. And increasing level of albumins in our blood lead to increasing of osmotic pressure, and water didn't move out from bloodstream into tissues. Vice versa, decreasing level of albumins, usually it named Kwashiorkor disease, if dramatically decreased level of albumins in plasma, lead to decrease in osmotic pressure, and blood, water from blood easily move out in tissues, and it lead to edema. You may find in this picture water placed in tissues, usually in its abdominal edema. And this may be a result of many diseases, like diseases of our liver, which produce normally albumins. And it may be a result of abnormal diet if a person didn't receive many proteins with food, many essential amino acids, it again may lead to decreasing osmotic pressure. Next group of proteins, it's globulins. And globulins again take part in transport function together with albumins, but mostly globulins are used for transportation of hormones, metals, some metabolites, and again drugs. And next component of proteins in plasma, it's fibrinogen. And fibrinogen together with prothrombin, it's proteins which realize regulation of hemostasis. And fibrinogen, it's a protein which start coagulation, start hemostasis. Prothrombin, It's additional factor for increasing efficiency and increasing speed of hemostasis. Uh, Today, a bit later, I will talk about these processes. Some proteins, mostly it's globulins, may take part in additional functions, like, for example, precursors. Uh, these proteins may used like sources for building some hormones and biological active components. For example, fibrinogen may convert to active component fibrin. Angiotensin may convert from inactive form to angiotensin active form. And again, it's a component of our proteins in blood. And a subgroup of globulins, they named gamma globulins or immunoglobulins, used for immune system, and it's very popular in nowadays during pandemic of coronavirus, because immunoglobulins, it's those part of our body which may resist from viruses invasion and try to attack and destroy viruses in our bloodstream. That's why level of immunoglobulins or gamma globulins are highly important for normal immune function. Now we tell about uh, cells in our blood and formed elements. One of most well-known formed element is red blood cells or erythrocytes. You know its historical name because they named by cells more than 200 years ago. But after naming, scientists find that in humans' blood, erythrocytes didn't have nucleus, and without nucleus, these red blood cells uh, didn't normal cells. They have no ability for growing, for dividing, and they have very short uh, lifetime, about 3 months. But removing of nucleus from young cells, stem cells, during growing, they remove a nucleus and became adult red blood cells. It's necessary for placing more oxygen in red blood cells and for more active changing form of red blood cells in vessels for better transporting in small vessels and capillaries our red blood cells, removing nucleus, and this helpful for more effective gas exchanging. And main function of red blood cells is transportation of gases like oxygen and carbon dioxide. Normal amount of red blood cells you may find in this picture. Again, they depend from age, they depend from gender, and in males, again, slightly more compared to females. It may really depend from a laboratory. In some laboratories measuring normal values for males 4.6 to 6 millions, for females 4.2 to 5 millions. In other laboratories, classical laboratories, in males 4.5 to 5 millions, in females 3.8 to 4.5 millions in 1 milliliter. But most important, comparing dynamic of red blood cells, because during some accidents, traumas, bleeding, we may find a decreasing level, and after curing, after some manipulations, we measuring change, increasing level of red blood cells. This is signal of normal curing, of normal manipulations. And now, answer please on this question. How do you think? It's correct or incorrect?
Correct.
It's correct. Yes. Actually, not only gender and age may affect on level of red blood cells, but even smoking. Because you know, smokers have chronic hypoxia, they have decreased oxygen consumption, and for increasing efficiency of transport for oxygen, these persons need increased level of red blood cells in blood. Okay. Process of maturation for red blood cells, you know, they take place in bone marrow and named erythropoiesis. And during this maturation, stem cells growing, dividing, and destroying nucleus. And only after this, adult red blood cells came to bloodstream and realized all their functions. In fetus body before birth, for producing red blood cells, they used other components of body like spleen, liver, and lymphatic nodes. But in adult persons, all these organs are not so important, and mostly bone marrow realized function of embryogenic erythropoiesis. For clinical aims, it's highly important measuring level of red blood cells. You understand, because decreased level of red blood cells lead to decrease in transport function. That's why it's very important. And decreasing level of red blood cells named anemia. If person have decreased level comparing to normal values, we tell about anemia. We have many types of anemia. Some of them associate with decrease in total amount of hemoglobin, protein, which realized association to oxygen. Some types of anemia have only decreasing amount of red blood cells, or vice versa, with normal amount of red blood cells, we may have decreased level of hemoglobin. That's why it's highly important comparing all these parameters together. Don't only red blood cells, or don't only hemoglobin level. We should analyze both these components for detection anemia. And anemia may be pathological, you know, after bleeding, after hemorrhage, or some destruction of red blood cells after some chemical substances, uh, chemotherapy, radiation, some drugs may lead to anemia, its pathological state, and some diseases, oncological diseases, inflammatory diseases, again may lead to pathological anemia. But tell me, please, how do you think physiological anemia, it's true or false?
True, sir.
Okay. Uh, could you give me examples of physiological anemia when healthy person may have decreased level of red blood cells?
When pregnancy,
Uh, Actually, it's not normal. Normal pregnancy may even slightly increase level of red blood cells.
During starvation,
Okay, what else?
period,
Yes, and uh, any other ideas?
in high pressure environments,
No. After intaking of huge amount of water, if you drink a lot of water, you decreased concentration of red blood cells, and as a result, in analysis, you may find in same volume of blood less amount of red blood cells. But it's a temporal effect, and after a few hours, excessive amount of water will remove by kidneys. But during this period, you may find physiological anemia. But all other examples is additionally correct, and good doctor should think about all these factors for prevent uh, making incorrect diagnosis. Not always increased or decreased level of red blood cells, it's pathology. In some cases, it may be normal, maybe physiological. And vice versa, increased level of red blood cells, they named erythrocytosis, and it may be relative or absolute. Absolute erythrocytosis, it's usually a result of answer on some pathological situations, like for example, uh, diseases in kidneys or tumor diseases may lead to erythrocytosis, or chronic hypoxia, or problems with bone marrow, oncological diseases in bone marrow may lead to polycythemia. But relative erythrocytosis, it may be physiological, like erythropenia, decreased level of red blood cells. It may be not abnormal, it may be in healthy persons. For example, water loss, dehydration. It may lead to increasing concentration of red blood cells in blood, but total amount of red blood cells didn't change. Again, you should remember about this for prevent incorrect disease, making diseases. And in our body, normally we have balance between level of red blood cells and uh, efficiency of transport. If oxygen level in blood decrease, it's signal for our organs, especially kidneys, for stimulation production of red blood cells. Especially kidneys, because they produce hormone which named erythropoietin, and this hormone stimulates bone marrow for producing more red blood cells, and during decreasing level of oxygen, more amount of red blood cells realized adequate transporting for oxygen. Vice versa, increasing level of oxygen in blood stop production of erythropoietin, and production of red blood cells decreasing. And this regulation, increasing or decreasing level of red blood cells depend from external factors, depend from amount of oxygen in air, in blood, lead to balancing and normalizing total amount of red blood cells for adequate oxygen consumption. For production of red blood cells, we use not only erythropoietin, but additional factors. Most important factors, it's vitamin B12 and folic acid. And these components used for growing and dividing red blood cells during erythropoiesis. And vitamin B12 increased processes of growing. Folic acid help for normal dividing these cells. That's why abnormal concentration of these components lead to abnormal form and size of red blood cells. Such kind of anemias like megaloblastic anemia, typical, for example, for B12 deficit anemia. When decreased level of this vitamin, red blood cells don't dividing, but growing again and again. And in our bloodstream, we have a small amount of red blood cells, but size of these red blood cells increase. Normally, diameter of red blood cells about 7.5 micrometers, but in megaloblastic anemia, it may increase up to 12 micrometers. Next factor for regulation total amount and activity of red blood cells, it's iron, because you know one of components for hemoglobin, it's iron, and this iron used for attaching oxygen and carbon dioxide. That's why decreased amount of iron again may lead to anemia. But this kind of anemia, they named hypochronic anemia, usually differ from other kinds of anemia. Vitamin B12 deficit anemia, it's less amount, but more size of red blood cells. In hypochronic anemia with deficit of iron, it's normal or increasing amount of red blood cells, but size is less than normal. And mostly we may find this kind of anemia by deficit of hemoglobin. decreased amount of hemoglobin, but not amount of red blood cells, typical for this kind of anemia. And some kinds of anemia associate with excessive destroying. You know, normally lifespan for red blood cells, it's about 3 months. And after this time, red blood cells destroy in spleen. But in some cases, due to inflammations or autoimmune disorders, oncological diseases, and some toxins, we may increase destroying of red blood cells, and this process became faster, not after 3 months, but early, more amount of red blood cells destroyed. And usually this kind of anemia associated with increasing level of bilirubin. You know, in spleen, after destroying of red blood cells, our body take hemoglobin for future utilizing, and take iron from this hemoglobin, and protein molecule divide and convert into bilirubin. This bilirubin enter in liver for using in digestive processes. But if we find increased level of bilirubin in blood and non-converting bilirubin before they came in liver, it may be symptom for anemia due to faster destroying of red blood cells in spleen. Due to some toxins and other factors, red blood cells may destroy it not only in spleen, but even in bloodstream. And this process of destroying, named hemolysis, destroying of red blood cells. And we have several reasons for hemolysis. First reason, it's osmotic hemolysis, and they happen when changed concentration of ions in water. And if concentration of ions in blood decreased, for example, after drinking a lot of pure water without cells, it may lead to osmotic hemolysis in this hypertonic solution. Water will came into red blood cells, and size of red blood cells increased and increased until they destroy. Opposite situation, it's again not good. That's why osmotic pressure, amount of ions in blood, it's very important, but didn't lead to hemolysis. It's lead to shrinking red blood cells in hypertonic solution. Next reasons for hemolysis, it's mechanical hemolysis. And this reason highly important for some surgical operations with external circulation of blood. For example, when performing operation on the heart, and blood circulate not through heart but through some artificial devices in tubes to this device, mechanical contact lead to destroying red blood cells, lead to mechanical hemolysis. Chemical hemolysis may happen when increased level of toxins, some poisons from snakes, for example, may lead to hemolysis, and some acids may lead to hemolysis. That's why abnormal increasing or decreasing pH, again, very harmful and may lead to hemolysis. And last one, it's biological hemolysis. Due to many toxins from snakes, again, from bites, and from bacteria like streptococcus, for example, which may produce an angina, but additionally in blood they produce toxins which increase destruction of red blood cells and may lead to hemorrhage. And next reason is thermal hemolysis. And thermal hemolysis, it's situation when abnormal increasing or decreasing temperature of blood may lead to destroying red blood cells. So doctors should remember about all these reasons, especially when we use blood for transportation, for transfusion from one person to other, because all these factors dramatically increased due transfusion. Improper transporting, improper temperature during transportation, mechanical shaking, all these factors lead to destroying of red blood cells, and as a result, after destroying of red blood cells, after hemolysis, blood may become poison for patient and may lead to damage. That's why we should avoid all these factors and decrease risk of hemolysis, and we should know or remember about possible reasons for that. Okay, next parameter which we measuring for detect functions of red blood cells, it's sedimentation rate. You know that without circulation, when blood circulation stopped, red blood cells pull down due to gravity, and it's process named sedimentation. But process of sedimentation depend from amount of red blood cells and depend from amount of proteins. That's why we measuring sedimentation rate for checking signals of inflammation, because increasing sedimentation rate usually associated with inflammation in blood. We have normal values you may find in this picture for genders. It may be differ. For males up to 10 millimeters per hour, for females up to 15 millimeters per hour. But during pregnancy, it may be even more, up to 30 millimeters per hour, and of course it's normal. What happened during sedimentation and why proteins level important? Actually, many proteins have positive charge and red blood cells have negative charge. And proteins work like a glue for faster attaching red blood cells into one big particle, which faster pull down due to gravity. This particle named Rulix, and increasing amount of proteins, like I previously said, mostly due to inflammation, lead to increase in sedimentation rate. But again, it may be not only during inflammation, for example, pregnancy, it's normal increase in amount of proteins during pregnancy. But as a result, we may find again increase in sedimentation rate. Okay, next parameter for detection quality of blood, it's hemoglobin. And this component of red blood cells, they consist from 4 particles, 4 particles of hem and 4 particles which named globin. Hem, it's particle associated with ferrum ions, and this is contact places for oxygen and carbon dioxide. And globin, it's proteins, it's 4 molecules of proteins, and these proteins may have slightly different structure. That's why we named chains. We have alpha and beta chains in adult hemoglobin. It means that 2 types of proteins slightly differ from each other. Normal value of hemoglobin you may find in this picture. Again, it's depend from gender. In males, due to increased level of red blood cells, total amount of hemoglobin in blood higher compared to females. And we measuring amount of hemoglobin for detection of anemia, because like I previously told you, not only total amount of red blood cells, but total amount of hemoglobin during decreasing may be symptom of anemia. And we used analysis of hemoglobin for detection additional diseases, because with hemoglobin associate many diseases. Anemia, it's only one example of these diseases. And some diseases like genetical disorders may affect on hemoglobin. For example, normally adult hemoglobin, which consists from 2 alpha chains and 2 beta chains of proteins, produced in bone marrow after birth. Before, in fetal growing, person have other types of hemoglobin. It's chains of alpha and gamma. But after birth, during first 2 months, fetal hemoglobin changed and increased level of adult hemoglobin. But during some disorders like oncological diseases, fetal hemoglobin may still placed in blood due to abnormal production in bone marrow fetal proteins, and we may find change not only total amount of hemoglobin, but we may find abnormal quality of hemoglobin when molecule of hemoglobin consists from abnormal chains, not adult chains, but fetal chains. It may be a symptom of diseases, like I say, for example, oncological. And inborn diseases like thalassemia, for example, again, it's diseases which associate with quality of hemoglobin and changed chains of hemoglobin, not two alpha and two beta chains like in healthy persons, but four beta chains, for example, uh, or four alpha chains may used for production one molecule of hemoglobin. But these molecules, it's abnormal. They lead to fast destroy of red blood cells. They lead to sedimentation of red blood cells in bloodstream, and as a result, abnormal forms of hemoglobin lead to anemia. And again, inborn diseases associated with genetical disorder, sickle cell anemia. Again, it's pathology of hemoglobin, which have abnormal structure and lead to very fast sedimentation of red blood cells. These inborn diseases, like thalassemia, sickle cell anemia, associate with genes and types of genes which lead to start inborn diseases with high frequency may meet in some regions. You may find in this picture, it's mostly Eastern and South Asia, Africa. That's why if you doctor and work with patients from these regions and your patient have anemia, you should think not only about oncological and inflammation reasons for anemia, but you should think about genetical diseases. And next, what you should know about blood and red blood cells, it's blood groups. Interesting that in history, detection of blood group associated with hemotransfusion, but hemotransfusions produced during many 100 years, and in ancient times, persons tried to make hemotransfusion for stop aging, for prevent some disorders, but they find patients will die after hemotransfusion, and first successive result of hemotransfusion was produced and recorded by Dennis Emmett in 17th century. And it's interesting that hemotransfusion performed not from one person to other, but from animal to person. Why hemotransfusions frequently lead to death, lead to problems, and even Emmett, after first successive hemotransfusion, when he tried to repeat his experiment, next patient died. It's due to some proteins which placed on our red blood cells, and depend of genetical properties. Our red blood cells have different types of proteins. In general, we name these proteins agglutinogen A and agglutinogen B. And you may find all persons divided on 4 groups. Some persons have only one agglutinogen, one type of proteins on surface of red blood cells. Some persons have both A and B proteins on surface of red blood cells. And some persons have not proteins, or these types of proteins, not A and not B proteins. They named O or 0. But additionally to proteins on surface of red blood cells, same genes coding production of agglutinins in blood. And when person have agglutinogen A, same person have agglutinins beta or anti-B in blood. Vice versa, person which have agglutinogen B on surface of red blood cells have agglutinins, proteins in blood, which name anti-A or alpha. And these proteins in blood used for detection atypical proteins on surface of red blood cells and destroy them. If agglutinin anti-B, for example, meet agglutinogen B, they will make agglutination of red blood cells and formation of Rulix for fast pull down of red blood cells and removing from bloodstream. Vice versa, agglutinins A, when they find agglutinogen A, connect together and form agglutination. That's why all unsuccessive samples of hemotransfusion associate with situation when person receive improper blood with improper blood group. If during hemotransfusion person receive not same blood group but other, process of agglutination of red blood cells and sedimentation, pull down take place. And when red blood cells pull down, they may stop blood circulation, may lead to anemia, hypoxia, and even to death. That's why in nowadays all surgical operations or hemotransfusions are obligate associate with detection blood group, and during hemotransfusion we used only same blood group for prevent this side effects. But we have many proteins on surface of our red blood cells. Of course, not only 2 types of proteins, and some additional types of proteins named, for example, rhesus factor or antigen D. And this rhesus factor have again a role in hemotransfusion because improper types of rhesus factor again may lead to agglutination. But for rhesus factor improper transfusion, slightly changed comparing to problems with blood groups AB. During hemotransfusion blood with presence of rhesus factor, they named rhesus positive, to person which have no this protein, they named rhesus negative. In person's blood start producing immunoglobulins, immunic proteins for detection this new for person's body protein. This process for detection and building a new type of immunoglobulins require time, usually about 1 week. And during this time, some proteins already dissociate, and it's not problem when immunoglobulins produced, they didn't meet abnormal agglutinins, agglutinogens in blood. But these immunoglobulins for detection rhesus factor or rhesus protein, after producing present in blood during all next life of person. And next hemotransfusion with same rhesus factor may lead to immediately affect and destroying of red blood cells will take place, and in this situation person even may die. That's why side effects for blood groups in system AB0, it's immediately side effect. Side effects when you transfuse blood groups by system rhesus factor, they named long-lasting side effect because they start not instantly, but only after second placing improper blood in person's bloodstream. And rhesus factor or rhesus conflict more frequently meeting not during hemotransfusion, but during pregnancy. Because pregnancy, it's situation when baby's blood produced their own proteins as a result of genes from mother and father. And in some cases, it's about 25%, mother may have rhesus negative, they have no rhesus factor in their blood, and baby take genes from father and produced rhesus factor, produced these proteins in their own blood. And this first pregnancy may become normal because, as I told you previously, first meeting lead to immunization, only to producing immunoglobulins. But second, and all other pregnancies with, again, rhesus positive baby may lead to rhesus conflict, and mother's immunoglobulins start attack red blood cells in baby's blood and destroy these red blood cells, and this named rhesus conflict. And this is very serious situation because due to rhesus conflict, baby even may die. And doctor should know about possible variants, and when mother rhesus negative, we should know rhesus factor from father, from baby, and on second pregnancy and all next, prevent rhesus conflict with special drugs. And last moment for today, in many old guidelines, you may find that we may use blood group 0 for hemotransfusion to all patients. Actually, you may do this, but you should know that it may lead to side effects. And agglutination may take place even when you transfuse other group, not same like in patient, but you should use for this side effect more volume of blood. Usually, if you transfused about 500 milliliters of blood and more, even a universal donor blood group 0 may produce agglutination and may produce conflict. That's why in nowadays guidelines say that in situation when it's not urgency and you may select between different blood groups for transfusion after surgical operations, after bleeding, you should prefer same blood group like in your patient. That's all for today. Thank you. Have you any questions?
Yes, sir. Sir, in O negative